Wow, yeah.
And it's ensured that the benefits are better. The core benefits of every plan are going to be the same as regular Medicaid. The extra benefits, again, they're going to be a little bit different depending on the plan, but they could include things like eyeglasses for adults. Mm-hmm. It's a very simple thing, but it's not covered under regular Medicaid.
Right.
Smoking cessation classes for people who want to quit smoking. Mm-hmm. They'll give you all the prescription drugs you need that will help you do that, but they'll also put you through some counseling that will help. There's special diabetes management classes. They have classes and special care for folks with asthma.
Right. Again, these are not normally covered.
Right.
Medicaid.
Yeah, these are all additional benefits that regular Medicaid people would not get.
Tremendous.
One of the ones that we're particularly pleased about that some folks are offering is special incentives for pregnant women to meet all their prenatal care visits with their OBGYN. And I'll give you an example. There's one plan that offers a gift card if the woman meets all her meetings with her doctor leading up to the birth of her child, they'll get a special gift card. There's one plan that gives away free car seats to women that go and they meet all their regularly scheduled appointments. Mm-hmm. That's tremendously important because we certainly want babies to be born healthy, and part of that is making sure that you meet all your scheduled appointments with your doctor.
Absolutely.
So they have these incentives built in to actually change the behavior of the patient, to really gear them towards some things that are preventive and that are going to make them and their children healthier in the long run.
You highlighted, Jeff, that there's a minimum of 3 plans.
Yes.
In all counties. Mm-hmm. Is that right? So, but there are up to 8 plans potentially.
Yeah. I believe Richland County, I think, has 8 plans.
Right.
And one of the beauties of the enrollment counselor service, which is that number that we gave out earlier,
right,
is if people receive this packet in the mail and they say, well, there are 4 plans, I'm not really sure which one would be best for me, I'm not really sure how to choose, they can call that number and a counselor will walk them through that process and help them choose a plan that's going to be best for them and their family.
Tremendous. 877-552-4642. Of course, the number's on the screen here. scchoices.com for viewers who may have internet access, but really picking up the phone is as good as anything. I'm sure there's a lot of great questions online. I think you highlighted there's some tremendous frequently asked questions at scchoices.com, but when you drove it down before we started filming earlier this morning, I know it has been an early morning for you, Jeff, but before we started filming, you drove home that point that it's just so critical to give folks the opportunity to make a choice, because if they don't make that choice,
well, one of the parts of this program is, yes, there is a choice option to it, and what I should explain too is, in addition to these plans, if somebody is more comfortable in regular Medicaid, they can stay in regular Medicaid if they want to.
Okay.
Now, we are really encouraging people to choose a medical home, but it's not something that we're requiring them to do. But I should say that if they don't make an active choice and they don't pick up the phone and call, or they don't go to the website and enroll that way, there is a chance that they might be placed in a plan.
Right.
We don't want that to happen. We want people to make an active choice and to say, okay, this is the plan I want, or to say, okay, I've looked at these plans and I still feel more comfortable in regular Medicaid. That's okay, but it's the fact that they've thought about it, that they've been engaged in the process, and that they've made an active choice. We want as many people as possible to make that active choice.
This is such a great example, Jeff, of the state and the federal government working together truly for the benefit of its citizenry. I mean, when you think of an example, this is probably one of the best examples where you're really encouraging them to do the right things, simply picking up the phone, but setting these plans in motion to give them incentives to do the right thing, to make sure they follow through. That example you gave for mothers or families to really follow through on checking up very regular on their appointments, to give them some added incentives. But this is all clearly for the good of that population.
And it is very different. There are other states that do coordinated care and managed care to certain degrees, but nobody's doing it quite like South Carolina is.
Right.
We felt that it was very important to have several choices and not give everyone one choice of plans like other states have done. We know one size doesn't fit all.
Right.
In healthcare or in really anything else in life. So we wanted there to be multiple choices out there for people, because people have different needs. And we also didn't want to have a situation where people were forced into a plan against their will, which is why we called it choices.
Right.
And it's why we're really trying to encourage people to make that active choice.
Are there folks that find out, we've only got about 5 minutes, Jeff, that find out that they're eligible for Medicaid, may not have known they were, and that, are there just real quick, just to have some idea of what some of those cutoffs are, or is that something even they could call the number even to find out if they're even eligible for Medicaid?
Well, they can do that. We're really would encourage people maybe more to visit our website, the agency's website, which I can give out if that's okay.
Let me go ahead and write that URL down. Thank you.
Sure. That's www.scdhhs.gov.
Okay, scdhhs.gov.
Right, and that'll have all the eligibility requirements in there, the income limitations, because it really depends on who you are and what your circumstance is to see whether or not you're eligible for Medicaid, because the income limits are going to be different depending on
That's a much more basic question, obviously, not directly related to the Healthy Connections choices, but I wanted to make sure that, because clearly we have some viewers who may be down on their luck or for a significant amount of time and may even be able to turn to Medicaid as an opportunity.
Well, yeah, particularly now with the downturn in the economy, we are seeing our enrollment numbers start to tick up, and that's usually the way it works, is when the economy goes south and maybe some people maybe have lost their jobs or having a harder time finding work, we will see more people applying for Medicaid.
Of course, if folks don't have internet access, they can go to the library, they can go a lot of places, but they need to visit scdhhs.gov.
Yes, and every county has a local eligibility office too. So if they looked in their local phone book, they would find a number for the local office and an address. They can go on in there, get all the information they need.
That is great. That is great. What are some of the most frequently asked questions you're getting about the plan? You've just kicked this off, Jeff. What is the if we visited the website, scchoices.com, we went to the frequently asked questions page. I'm not trying to have you make my job easy here, but since we got 5 minutes, I want to make sure we get to the meat of the issue.
A couple of the top questions you get, and I think we covered the first one, which is, why are we doing this?
Right.
And again, we're doing this because we're trying to improve the long-term health outcomes of folks.
Right.
One of the other questions we get is, well, how are my benefits going to change? And if I choose one of these plans, am I going to is this going to hurt me? And the answer to that question is no. And again, like I explained, the core benefits of every one of these plans is the same as regular Medicaid.
Right.
It's just that they can offer extra benefits as well. So that's really the message we want to send, is that there's no reason to be fearful of these plans. These plans are a good thing, and it's really something that we hope everybody considers.
Right.
One of the other things about the plans that I didn't mention earlier when I was talking about some of the benefits is under regular Medicaid, there are copays that are required for doctor visits. Now, they're very minimal copays. They're $2 here, $4 maybe for a certain other type of visit. The plans have waived the copays. So
across the board?
Yeah. So, so it is also less expensive to be part of this plan.
Yeah.
So,
well, why wouldn't everybody get fired up? And
I'll give you one example for somebody that would maybe not want to join one of these plans, and it is something that we talk with people about. When they call that enrollment counselor number, one of the first questions they're going to ask is, do you have a doctor that you see now? Do you have a regular doctor?
Right.
If the answer to that question is yes, the enrollment counselor will find out who that doctor is and see what plan they're in. It's possible that they have a doctor that's not part of one of the health plans. And in that case, they would probably want to stay with regular Medicaid. Because again, the whole purpose of this is to try to keep people with their doctor.
Right.
And if they've got a doctor that they're happy with, that they see on a consistent basis, we don't want to interrupt that relationship.
Those are not the participants who are getting you down on number 48.
That's
those
absolutely
are the folks
correct,
that are probably on the northern end of the states there.
Yeah,
Right.
those folks are probably going to be the rarity. But again, we did want to let them have the option of staying with the doctor that they liked if the doctor didn't participate. Now, I should say that the majority of physicians in South Carolina are participating with these plans, and and many of them like them because they actually get paid a little bit of a higher rate too by these companies than they get under Medicaid. So it's really a win-win for everybody.
For everybody.
It is.
How exciting. And of course, to really see South Carolina taking it, making sure this is not an instance, and you can act swiftly here. You all are traveling around the state to really nip it in the bud and try to change those numbers so we're rising out of that to bottom sphere, at least to the middle range, and then hopefully into the top sphere.
Yeah, hopefully higher. Hopefully higher. Yeah.
That's very exciting. What's been the best aspect for you, Jeff, having joined the Department of Health and Human Services just 3 years ago, what's been the most exciting aspect for you over the last 3 years?
Probably what I like the most is, and it may sound a little corny, but I enjoy helping people. In my former life, as I explained before, when I was a reporter, I thought I did sort of a public service by some of the stories that I wrote, letting people know what was going on. I feel that much of what I do now is the same, by keeping people informed, letting them know about their benefits, and hopefully helping them stay healthy in some small way. So that's really the most rewarding part for me.
Those are real simple words, but right to the core. Jeff, sorry we've run out of time.
Thank you.
Thanks so much for being with us this morning.
All right, thank you.
Absolutely. Stay tuned to more Carolina People with Jeff Stensland, the Director of Communications for the South Carolina Department of Health and Human Services, coming up next. Got to get this number out, 877-552-4642. Take the time to write that down. If you're on Medicaid, if you know somebody on Medicaid, you're not sure if they've enrolled with one of these plans, you're not sure if they've made a choice, tell them to write this number down, 877-552-4642, Monday through Friday, 8 to 6. Wait 30 minutes now. Just wait 30 minutes, but write that number down. And when you get to work, make the call or take a break on lunch or wait till 8 o'clock. All calls are free. All calls are private. These enrollment counselors are here to help you. This is clearly a program. South Carolina doesn't want to stay down at number 48. They want to get up and get up and get up and continue to make a difference for its citizens, making a difference every day. But take the time. You can go online to scchoices.com, but please know you need to take the time to make the choice. Jeff Stensland, thanks so much for being with us this morning and doing everything you're doing.
Thank you. I appreciate it.